Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about nerve damage. This is the next step, or another step, in helping you understand your peripheral neuropathy. And really, there are 5 types of nerve damage. So to help you get a better understanding, I want to remind you of the anatomy that we talked about a couple days ago. We have the cell body, we have the dendrites coming onto it, cell body, and then you have the axon. Most of the damage that will happen to a cell or to a nerve cell is going to happen at the axon level. So there are really 4 types that we will do for that. First type is compression. So if you get compression on that nerve, you start to compress that nerve, what happens is it can't get the circulation it needs, it can't get the signal it needs, and it interferes with that signal in such a way that you will start to get either nerve pain or failure of the nerve signal to function like it's supposed to, so it's basically interrupts it in a way. The second type is a type where you actually lose the lining or the sheath of that nerve. If you remember, you have the myelin sheath. It's made of swan cells that wrap that nerve. If you injure those cells and they disappear, or you lose them in some way because of damage or whatever, then the signal of that nerve will slow down or be weaker, and that can cause the symptoms of peripheral neuropathy. Ultimately, it'll interfere with that functioning of that nerve, and so it doesn't function like it's supposed to, and you get the peripheral neuropathy symptoms. The third type that can affect the axon is nerve degeneration. So if you get injury to the nerve in such a way that it starts to degenerate, then you will find that the nerve itself can't get the signal because you're losing that axon altogether. And typically this degeneration will happen at the axon level, and it's really common. When we do an epidermal nerve fiber density, for example, that's what we're looking for, is either nerve degeneration or absence of nerves. With nerve degeneration, it's early on stages of peripheral neuropathy. If you have absence of those small fiber nerves, then you know that you're further on in the peripheral neuropathy process. So the fourth type is signal interruption. So if you say, okay, I'm going to take a wire, an electrical current, and I'm going to cut that wire, you interfere with that signal getting from one wire to the next. So you flip the light switch and it doesn't get to the light because you've interrupted that signal. Same thing happens with the nerve. If you interrupt the signal, then it cannot get to that nerve or back to the brain or to the spinal cord. And so because of that, you get the symptoms of peripheral neuropathy. This is the type of injury that would happen, say, from a trauma or from a surgery or something that actually interferes directly with that nerve, whether it's a separation of the axon from the cell body, or whether it's an interruption of the axon itself, whether it's loss of dendrites, whatever the reason, you're getting an interruption of that signal. And because of that, you get the symptoms of peripheral neuropathy as well. And the fifth type actually happens at the cell body. We've talked about this before. We actually said yesterday about mitochondrial damage, which is a very common type of peripheral neuropathy, or cause of peripheral neuropathy is cell damage. So as you get that cell damage, it's caused by this mitochondrial defect or mitochondrial failure. What you're doing is you're doing one of 3 things. You're either causing the cell itself to die, you're slowing down the function of that cell in such a way that you're not getting the neurotransmitters where they are supposed to be, or you're interfering with nerve repair. In all cases, this nerve becomes non-functional and ultimately can die or have cell death, which can also cause a peripheral neuropathy in that area. So you've got those 5 types. Why does it matter which type you have? If you have one of those 5 types, what does it matter? Well, the truth is, what it comes down to is you're saying, okay, I've got one of these 5 types. If I have compression, how do I treat it? You remove the compression. If I have swan cell loss, how do I treat it? You do either nutrients or actually MLS laser to actually help it repair. If you have degeneration, nutrients are very, very good at repairing degeneration, as is MLS laser, because it stimulates the body to heal. So no matter where this problem is, there are treatments, there's things that you can do as far as exercise or nutrients or whatever, based on the type of peripheral neuropathy damage that you have, the type of nerve damage that you have. So you can actually determine, what should I do based on the type of nerve damage you get. So this is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 33. So tomorrow we will continue with additional information on how to